Are you confused between PT and APTT? Let's make it simple. In this video, we'll break down how blood coagulation works, how PT and APTT test helps assess different pathways. Perfect for NEET PG and MBBS students. Let's dive in. First, understand the coagulation cascade. There are three key parts of the coagulation cascade. First is extrinsic pathway, then intrinsic pathway, and common pathway. The extrinsic pathway is triggered by tissue factor released from damaged subendothelial tissue. It activates factor 7. The intrinsic pathway initiated when blood comes into contact with negatively charged substance like exposed collagen. Here the sequence begins with factor 12, which activates factor 11, then factor 9, and finally factor 8 acts as a cofactor. The common pathway starts when activated factor 7 from intrinsic and activated factor 9 from extrinsic pathway activate the factor 10, which become factor 10A. Factor 10A with help of factor 8 converts prothrombin to thrombin. Thrombin converts fibrinogen into fibrin, forming a stable clot. To understand PT and APTT better, let's look at the origin of the test. Prothrombin time requires a reagent called thromboplastin, also known as tissue factor, which naturally exists in the brain. In lab, it is often extracted from human or rabbit brain through ultracentrifugation. PT is the time in second takes to form a clot when patient plasma is mixed with thromboplastin and calcium. However, thromboplastin from different sources can vary in activity. To standardize results, a value called ISI, International Sensitivity Index, is used. Also, since different instruments can give different PT values even with same thromboplastin, we use INR, International Normalized Ratio, to allow reliable comparison across labs. After PT was discovered, scientists noticed that diluted thromboplastin could differentiate between hemophilic and normal plasma. This became partial thromboplastin time. Later, adding a surface activator like kaolin shortened the reaction time, gave us the activated partial thromboplastin time. Later, it was found that diluted thromboplastin was too weak to initiate a coagulation, and clotting started by contact activation from glass surface of the test tube. Hence, this became the intrinsic pathway as no external factor was needed for APTT reaction. In contrast, adding tissue factor externally was required for the other pathway, the PT reaction, hence named as the extrinsic pathway. So please remember, these names are based on in vitro lab observation and still help us to understand the clotting pathway. Now look the common causes of PT and APTT. This is a very important topic for your exam. Now cause of isolated prolonged PT. So here the defect is in extrinsic pathway. Most common causes vitamin K deficiency as seen in malabsorption or newborn, warfarin therapy or liver disease. This causes impaired synthesis of clotting factor, early DIC or very rarely factor 7 deficiency. The causes of prolonged APTT with normal PT. So the defect is in intrinsic pathway. The common causes are hemophilia, hemophilia A due to factors 8 deficiency, hemophilia B due to factor 9 deficiency, hemophilia C due to factor 11 deficiency. Other causes are von Willebrand disease, lupus anticoagulant in Apla's syndrome, heparin therapy. Please remember one thing, factor 12 deficiency, usually patients are asymptomatic, there is no bleeding, but APTT is very high. Now the causes of both PT and APTT prolongation. So there is defect in common pathway. This can be seen in severe liver disease, advanced DIC, massive transfusion without adequate coagulation support, or severe cases of vitamin K antagonist toxicity, and cases of factor 5 and factor 10 deficiency. One important test when PT or APTT is prolonged is mixing study. It helps to determine why clotting is impaired. Is it due to factor deficiency or due to an inhibitor? So we mix equal part of patient plasma and normal pooled plasma, then repeat the PT or APTT. If the result corrects to normal, the problem is likely a factor deficiency. If it remains prolonged, An inhibitor is probably present, such as antibodies against clotting factor. One special note, factor 8 inhibitors may need up to 2 hours to be active. So if you are checking for factor 8 antibodies, the mixed sample must be incubated for 2 hours before testing. Now let's quickly understand two special type of mixing study used in coagulation test to screen factor deficiencies, aged plasma and adsorbed plasma. Now what is aged plasma? Aged plasma is a stored plasma usually kept at 4 degrees centigrade for 48 hours or more. During the storage, the labile factors like factor 8 and factor 5 are degraded. So this lacks factor 5 and factor 8 and retains factor 2, factor 7, 9 and 10. In mixing study, if clotting reaction with aged plasma is corrected, this means patient plasma is deficient of stable factor like 2, 7, 9, 10. If it is not corrected, then suspected case of labile factor deficiency like factor 5 and factor 8. Adsorbed plasma is made by treating normal plasma with barium sulfate. This process removes vitamin K dependent factors like 2, 7, 9, 10 from the plasma. So what is left? Factor 1 or fibrinogen, factor 5, factor 8, factor 11, 12 and others are left. In mixing study, if clotting corrects with adsorbed plasma, patient lacks labile factor like factor 5 or factor 8. But if it is not corrected, the deficiency is likely vitamin K dependent factor, since adsorbed plasma does not contain them. So please remember some exam points. So isolated PT prolongation, it suggests an extrinsic pathway defect. So please think factor 7 deficiency, warfarin therapy or vitamin K deficiency. Isolated prolonged APTT points toward extrinsic pathway defect. Think hemophilia, heparin therapy, lupus anticoagulant. Both PT and APTT prolonged. Most commonly these causes are common pathway defect and consider severe liver defect, DIC or vitamin K antagonist overdose. Mixing study interpretation, if it is corrected, then there is factor deficiency. If it is uncorrected, then inhibitor. Aged versus adsorbed plasma. Please remember, aged plasma means labile factor are absent. These are factor 5 and factor 8. And adsorbed means vitamin K dependent factors are lost. So there is no 2, 7, 9, 10. So at the end of this video, one message is clear. You can't just mug up the coagulation, you need to understand it. If it is still confusing, don't worry, just rewatch the video, take note and connect the pathway logically. The more you revise, the clearer it gets. So thank you for your patient learning. If you found this helpful, don't forget to like, share and subscribe to the channel for more high-yield medical content. Thank you.